And the service line councils will be responsible for answering the questions about where those pre-acute care services need to be offered in the 5-county region. Then when we talk about the acute care services, that focuses on pretty much the regulated environment that we work in, the hospital services side of things, the emergency department care, the observation status for patients, the admissions into our hospitals, the surgical services that are offered both on an inpatient basis and on an outpatient basis. Those primary elements make up the acute care part of our services. So as an example with orthopedics, again, what we need to answer is where will our patients receive their acute care orthopedic needs? Where will they have their surgeries? Where will they be admitted to the hospital? Where will their emergency care be managed, and how will that patient go from the emergency room to the other acute care facilities within our services? So we need to answer those questions for the acute side on a service-by-service basis. And then the final area, the post-acute care, is just as important, because under the new world about well care, we really need to make sure that we're coordinating our patients' care before they come into our hospital system and after they use our hospital services. So it's the coordination of that care. It's the home health services. It's the rehabilitative services if rehab is needed. It's working with hospice care if needed, or palliative care if needed. So how do we transition those patients effectively throughout the service area that we cover for that post-acute care needs? That is the focus of our Strategic Services Delivery Council, is to identify the solutions to that model, to develop that model that will answer those questions for us on a service line by service line basis throughout the 5-county region for each of the services that we offer. What's important to also note is that there's a role that I think the county and town play in this solution process. So mainly I see it on the post-acute care side. When we talk about continuums of care, the county and town offer services that we need to link effectively with our patients. Department of Health Services, social services, EMS and the providers getting more involved in the care of our community as well. So partnering with our community providers, partnering with the town and counties that we serve, creating that continuum of care that's going to keep our patients healthy and only bring them into the hospital system when it's absolutely necessary. So that's part of our focus. In addition to defining the service delivery model, we need to answer the questions about transportation for those services. 375 square miles of territory is a lot of territory to cover, and there are a variety of different transportation systems in each of the counties. And our challenge as one system in 5 counties is to integrate that transportation system to the services that we offer in our community. So it's critical that that component be overlaid with any recommendations that ultimately come to our board. So that process that our board has asked us to undertake as part of our strategic plan is now getting underway. And by getting underway, I mean that we've identified the members of the Strategic Services Delivery Council. That council has over 30 members, and it includes members from our board, from our management team. There's a few of us on that as well. But mainly that group consists of, in large part, physicians who use our services and who refer patients to us over the 5-county area. That council is now going to be the overseeing body that the services plan will feed up to. And right now we are also in the process then of creating those small service line councils for cancer, for orthopedics, for behavioral health, for primary care, for medical specialties and surgical specialties. We're getting all of those subcommittees formed with representatives from our physician community and our team as well, and from experts throughout the community as well. All of that is being formed as we speak, with the intent of having our first series of meetings in the early part of August of this year. Again, with the intent of creating that plan that we will bring back to our board of directors for conceptual approval, ideally by the end of this calendar year. So they'll have from the first part of August to the end of December to collate their thoughts and impressions into one regional plan for our system. At which point our board of directors, who I think it's important to stress, is made up of local members of our community. Even though we are fully owned by the University of Maryland Medical System, we have 24 board members on our board of directors. Only 2 of those members are representatives from the corporate office at the University of Maryland Medical System. And that's the CEO of the medical system and the chief strategy officer for the medical system. Those are the only 2 UMS representatives on our board. The remaining 22 out of the 24 members are local community members representative of the 5 counties that we serve. So that board will then hear the plan that comes up from the Service Delivery Council and decide what the next step should be and how that should be enacted. That's the steps that we're in now. No decisions have been made with this process. We are evaluating what our future needs even look like in the realm of national change and very dramatic state change. And we're trying to be proactive and 2 steps ahead of where the industry is, where our competitors are, in putting a plan together that's going to help us not only survive as an organization, but thrive as an organization in this dynamic world we live in. And I personally see a couple of different opportunities for the public to get engaged. I foresee an opportunity during the process. So as the Service Delivery Councils are meeting, have focus groups throughout the counties that we serve. Get feedback and have a discussion with our community about the healthcare services that they receive and how it can evolve to become a better system in the future. So I see that happening during the work of the Strategic Planning Council from August to December. And then I believe our board is going to make sure that if we hadn't done it effectively enough during that time period, that we then take the plan that's brought up to the board and vet it through the community before the board ultimately gives its blessing.
From my end, I get the people that hear just the idea that the hospital's considering certain things, and then what I get is the hospital's closing down completely. And so those are the calls and emails that I'm constantly dealing with. So I know the future is uncertain, but can you give us at least some assurance that there will be some form of a hospital/emergency room at this site in the future?
Mr. Mayor, I share your concerns because as you get those calls, I get those calls as well. And we have over 600, 700 employees, 600 to 700 employees just covering the Chestertown, Kent County area, and 2,500 employees that cover all of Shore Regional Health. Very concerned, and when rumors like that go out, it's something that I take very seriously and that I respond to very quickly. With regard to Chestertown, the Shore Medical Center at Chestertown will continue to be a viable organization in Chestertown and in Kent County for the foreseeable future. We have an obligation to this community to provide excellent health care for the patients and members of our community. What that care looks like, what services are offered, that's what we're trying to determine as we speak. But we will continue to have a presence in this community as long as I'm here and for the foreseeable future. Our board has committed to the 5 counties that we serve, of which Kent County is one. Chestertown is a big component of that with the current medical center here. We don't see that changing moving forward. But one thing I want to be clear on is that Shore Regional Health cannot be all things to all people. The days of us being able to provide every level of service in all locations are far gone. But what we made a commitment to do is to be the best at those services that we do offer. We know we can't offer everything. We're not going to do heart surgeries within the Shore. But we need to align ourselves with organizations that can do that for us, that provide great outcomes, and then we need to work on the transportation mechanism so that they get there effectively, and if helicopter is an option, as it is in some cases, effectively and as with minimal cost as possible. So we recognize that we have our own limitations. We're defining what those are, and we are working very hard to make sure that once we do define that we've got the facilities to support those services, and that the outcomes that we obtain from every patient that uses our services is great, and they come back for more. Because that's what's going to make us or break us as an organization. Under this new model, if your patients migrate out of your service area, you lose that market share, you lose that revenue that's with that. And the more revenue you lose, the harder it is to reinvest and grow services in our community. And then it's almost a downward spiral from there.
I would like to reinforce one of the points that Linda made, which, again, because I'm sort of more on the grassroots of the complaint level, and that is, hey, if I get a heart attack, can I go there, or am I going to have to go to Cambridge? And so my recommendation, I know it's early in the process, but if and when you have a public meeting in December or January or February or March, I would spell all of that out as clearly as possible, because it is a big deal. I mean, we're a very rural area, and it's especially true of people in, it would be a bummer for me if I had to go to Easton, but if I'm in Rock Hall, that's another 20, 25 minutes, and it's a big deal. So just spelling it out and, dumbing it down to just, if you have a stroke, you go here. If you have a heart attack, it's this. If you break your ankle, maybe it's
Here's
easy.
your options.
You know,
Those are such important answers to questions we have to raise, Mayor. You
Right.
hit it right on the head, and you hit it right on the head too as well, ma'am. That's why our board is really requiring us to go through these steps to very clearly define that, so that those questions, when we do get out into the public forum, are very clearly answered.
right.
And that, and they're not thought of by administrators or by a board who has limited healthcare experience. They're thought of and crafted mainly by physicians who care for our patients in those specialty areas. So the cardiologists will sit down and talk about how heart care is covered from education and screening and diagnostic testing, all the way through to PCI, which is freeing the potential block in an artery, all the way to open heart surgery. So define what it looks like and where our patients go in each of those circumstances.
But, you know, if you're, God forbid, Chris, suddenly having a heart attack, or my husband is having a stroke, my first stop is still going to be the emergency room
That's right.
on
Well, we hope.
Ground Street. I mean, there's not surely any consideration
Please don't drive yourself.
of considering an emergency room.
That's right.
You wouldn't,
I'm sorry.
you're not considering limiting the emergency services at any
We
of the
just made a
hospitals.
significant investment to the
Yeah,
emergency
exactly.
department here in the hospital. It's money extremely well spent and
I
sorely needed by the community.
Assume all the emergency rooms in the system will do the initial.
I understand what you're saying, but I think they need to hear it from you.
Yes, I hear you. And you know, I'm here today to share with you the process that we're currently embarking and the timeline that's
Yeah.
associated with that, and trying to give you the assurances that there will be community involvement in the process. And our board, which is made up of local directors who live in this community, who use the healthcare services of our community, will ensure that not only today, but long into the future, the models that we create under the new environment that we're working in are going to be those models that produce great quality outcomes for our patients.